Now in the second section, we will talk about the CSF PCR, which is the polymerase chain reaction. And in this, we will specifically talk about the varicella-zoster virus infection, herpes simplex virus CSF polymerase chain reaction, and also we will talk about the EV and Epstein-Barr virus cerebrospinal fluid polymerase chain reaction. So first, the varicella-zoster virus, VZV, varicella-zoster virus. Primary diagnostic test is the CSF polymerase chain reaction, detection of virus-specific IgM, intrathecal antibody synthesis detection. So this is in the varicella-zoster virus infection, varicella-zoster virus CNS infection, some tests that can detect or help us to diagnose its varicella-zoster virus infection is the polymerase chain reaction test. If there is a virus-specific IgM present, immunoglobulin M, and also intrathecal antibody synthesis detection. So all these are the tests that help us to diagnose. Herpes simplex virus CSF polymerase chain reaction. It's the sensitivity and specificity of this test may vary. How sensitive and specific this test is for the diagnosis of herpes simplex virus infection. Timing of the test, prior use of antiviral therapy in relation to onset of symptoms. So this is important. So there are some factors that affect the sensitivity and specificity of this polymerase chain reaction in herpes simplex virus infection, and the timing is very important at the time when the test is performed. If it is prior use of antiviral therapy affects the result, and also the onset of the symptoms can affect the result. Negative polymerase chain reaction reduce the likelihood of herpes simplex virus encephalitis. So again, it is very specific for herpes simplex virus, and if it is negative, then we should not, it excludes the possibility of having herpes simplex virus encephalitis. Next, EV and Epstein-Barr virus polymerase chain reaction, enteroviral. EV is enteroviral. Entero is for the intestine. So, intestine enteroviral cerebrospinal fluid polymerase chain reaction. Sensitivity and specificity is more than 95%. So, it's very effective in the diagnosis of enteroviral encephalitis. Sensitivity for enterovirus 71 is lower as compared to other enteroviral types. Paraechovirus is not detected by the polymerase chain reaction. So, enterovirus, very high specificity, lower for enterovirus 71, and paraechovirus is not detected. Then we have Epstein-Barr virus cerebrospinal fluid polymerase chain reaction, specificity not established, reflect reactivation of Epstein-Barr virus latent, in lymphocyte entering central nervous system, unrelated infectious or inflammatory process. So sensitivity is not established in case of Epstein-Barr virus as compared to enterovirus, in which we have more than 95% sensitivity and specificity. But what does it reflect is the reactivation, the Epstein-Barr virus, which is in the body present as in the latent phase, it tells us about the reactivation of that virus in lymphocytes entering central nervous system, an unrelated infectious or inflammatory process. Some other infections in which we can see the effectiveness of CSF polymerase chain reaction. We have varicella-zoster virus, CSF antibody and polymerase chain studies. Intrathecal synthesis of antibodies, patient may have negative polymerase chain reaction. West Nile virus infection, less sensitive. Detection of West Nile virus specific CSF IgM and useful in immunocompromised patient. So different viral encephalitis have a different level of sensitivity and specificity as far as polymerase chain reaction is concerned, and it detects the presence of antibodies against the virus. That was all about section 2. Thank you for watching sqadia.com.